Hello and welcome. Today we're diving into a less commonly discussed but important condition of the urinary system: ureteral polyps. These growths in the ureter can lead to a variety of issues, and understanding them is crucial for effective diagnosis and management. Let's explore what they are and what you need to know. The exact cause of ureteral polyps remains somewhat unclear, but several factors are believed to contribute to their development. These include chronic inflammation of the ureter, perhaps due to recurrent urinary tract infections or kidney stones. Certain genetic predispositions may also play a role. In some instances, polyps can arise as a reaction to injury or irritation of the ureteral lining, and rarely they may be associated with certain syndromes or genetic abnormalities. Research continues to explore the specific mechanisms driving polyp formation. At a cellular level, ureteral polyps develop from the inner lining of the ureter, known as the urothelium. Abnormal cell growth and proliferation lead to the formation of these masses, which can vary in size and shape. As the polyp grows, it can obstruct the flow of urine from the kidney to the bladder. This obstruction leads to a buildup of pressure within the kidney, known as hydronephrosis, which can damage the kidney over time. The polyp may also cause irritation and bleeding, contributing to the symptoms experienced by affected individuals. Ureteral polyps are relatively rare, making it difficult to determine their precise incidence. They are more commonly diagnosed in adults, although they can occur at any age. There's no definitive data showing a strong gender predisposition, but some studies suggest a slightly higher prevalence in men. Further research is needed to fully understand the demographic distribution of ureteral polyps and identify potential risk factors within different populations. The signs and symptoms of ureteral polyps can be quite varied, depending on the size and location of the polyp, as well as the degree of obstruction it causes. Common symptoms include flank pain, which is pain in the side or back, and hematuria or blood in the urine. Some individuals may experience frequent urinary tract infections, difficulty urinating, or a feeling of urgency to urinate. In some cases, small polyps may not cause any noticeable symptoms, leading to delayed diagnosis. Diagnosing ureteral polyps typically involves a combination of imaging techniques and endoscopic procedures. A urinalysis may be performed to detect blood or infection. Imaging studies such as a CT urogram or an intravenous pyelograms IVP can help visualize the urinary tract and identify any abnormalities. The gold standard for diagnosis is ureteroscopy, where a thin, flexible tube with a camera is inserted into the ureter to directly visualize the polyp and potentially obtain a biopsy for further examination. Ureteral polyps can be broadly classified as benign or malignant. Benign polyps are non-cancerous growths, while malignant polyps are cancerous. They can also be classified based on their histological appearance, such as inflammatory polyps, fibroepithelial polyps, or papillary polyps. The specific type of polyp will influence treatment decisions and prognosis. Treatment for ureteral polyps depends on the size, location, and nature of the polyp, as well as the patient's symptoms and overall health. Small asymptomatic polyps may be monitored with regular follow-up. Symptomatic polyps typically require intervention. Ureteroscopy with polyp removal is a common approach, allowing for precise removal of the polyp. In some cases, open surgery or laparoscopic surgery may be necessary, especially for larger or more complex polyps. If the polyp is found to be cancerous, additional treatments such as radiation therapy or chemotherapy may be recommended. Unfortunately, there's no definitive way to prevent ureteral polyps. However, maintaining good urinary health can potentially reduce the risk. This includes staying well hydrated, promptly treating urinary tract infections, and avoiding prolonged exposure to irritants or toxins. Regular check-ups with your doctor may also help detect any abnormalities early on. The prognosis for ureteral polyps is generally good, especially when diagnosed and treated promptly. Benign polyps that are completely removed usually do not recur. Malignant polyps require more aggressive treatment, and the prognosis will depend on the stage and grade of the cancer. Recent research is focusing on developing less invasive techniques for polyp removal and improving the accuracy of diagnosis. Additionally, studies are investigating the genetic and molecular mechanisms underlying polyp formation, which could lead to new strategies for prevention and treatment. We hope this overview has provided valuable insights into ureteral polyps. Thank you for watching!